All right, so the next technique is joint-specific traction. So with this technique, what you're going to do is get traction from a rotational direction. So you're going to want to stabilize the mat side of the spine right here, and then you're going to want to mobilize the sky side of the spinous process right here. So you're creating a rotational force through this. All right, now I'm going to show you on my model here. You're going to keep the patient in a neutral, comfortable position. I'm going to show you how to do joint-specific traction from L1 down to L5. All the principles are the same. However, at L5, S1, the coupling pattern changes, so I will show you that technique second. So basically here I am at L1 and this is L2. I'm going to stabilize the mat side of the spinous process and I'm mobilizing at the sky side. So I'm moving L1 on top of L2. There's several different ways that you can do this. You kind of just need to figure out what works best with your hands. Some therapists will actually mobilize through their thumb like this. However, I find that my thumb hyperextends when I do that, so I like to use my fingertips. And you want to stabilize several levels. You don't want to stabilize just one, which is why I keep my hand flat against the spinous process. Get in the habit with your joint mobilizations going all the way to 100% and then back off to 80%. Back and forth like that. Another great technique to do is incorporate neuromuscular re-education with this. So, after I've taught them to fire their transverse abdominis, I'll incorporate it with my treatment for neuromuscular re-education so they can learn to stabilize that segment with a rotational movement. So I'll say, go ahead and flex your transverse abdominis. Good. I can actually feel his multifidus co-contract with this as he fires his transverse abdominis. Then I'll go down to the next segment.